I gotta wait? How long I gotta wait for a press record?
Go.
Welcome to the shed, where Miss Dream always has a story.
It's Dream, and we got a season 2. Your Black Bostonian here, a product of a single mother who I work to make proud every single day. I'm a 3-degree holder, your veteran educator, your tech entrepreneur, and founder of the Chair platform. My platform is dedicated to supporting Black and Brown people on their hair journey by creating hair boards, connecting to hairstylists, and sharing haircare tips for a more joyous experience. My podcast is about sharing hair stories, educator stories, entrepreneurship stories, and stories surrounding identity with goals to leave you laughing, learning, and advocating. So come in and listen to the stories in the chair.
Where we share stories in the chair.
Hello, beautiful people. This is Arielle. Arielle, can you please introduce yourself?
Yes. Hi, my name's Arielle. I am currently an ICU nurse at a level 1 trauma center. I was originally from Massachusetts, and now I live in Florida with my 2 little rascal cats.
Arielle and I met at camp many years ago. And there are a couple memories I have of Arielle. Arielle has this beautiful, big, curly red hair. And because her name is Arielle, there's obviously the Disney reference. And Arielle would sing. And so I just couldn't help myself. So I'm always singing Little Mermaid. And we would always just be singing and laughing together at camp. And so that is definitely a core memory of mine.
Yes, you were actually the first person I met at that camp.
Really?
Yes, you're the one that gave me the nice tour.
Okay. Yes. It's all coming back to me now. I loved giving a good tour. And I asked Arielle if she would like to be on the podcast because she is in the medical field, and I think it's extremely important to highlight professionals doing so much service work and, of course, not getting enough credit. And she graciously said yes. So I'm happy you're here.
I'm happy you're having me here.
So, did you always know that you wanted to be a nurse?
Kind of. I always knew I wanted to be in the medical field in some form. And it did take me a while to kind of find specifically what I wanted. But I did know that the medical field was for me because when I was younger, I had a sister who was about 5 years older than me. And I would kind of watch her hurt herself, or she would pass out during like family dinners because she wasn't always taking care of herself. And I was maybe second or third grade around when this was happening. So I'm young and I'm like, well, I don't know what to do. And I think feeling that sort of helplessness in medical emergencies made me more driven to want to go into the medical field so I know how to help people when they need that help. And when I used to visit her at some of the psychiatric facilities that she would be admitted into, all the nurses were just so helpful and they were so nice to not only my sister, but my family when we would go visit her. And I think that's kind of what solidified me wanting to be a nurse.
How long have you been in the nursing world?
I have been a nurse since 2021. Prior to nursing, I was what we call a nurse technician, which is very similar to a CNA. But instead of you getting a CNA license, you work as a CNA after taking your foundations class, which is where you learn how to do bed baths, feeds, and just like basic activities of daily living or ADLs. And then before that, I worked in transport for a little bit to kind of get my foot in the door. So I've been in the medical field in general since 2020.
In your role now, do you see yourself as an educator?
100%. Every single nurse I know is an educator. We like to teach not only our patients, but the patients' families about what's going on. And I find that in the ICU, I do a lot more education to the families because sometimes the patient can't listen, can't talk. There's a breathing tube down their throat, or they're too sedated to be able to participate in these sort of conversations at the moment. So we're always taking our time to not only educate patients' families, but we're teaching our future nurses how to be great nurses and how to take care of people. I also find that nurses are like lifelong students as well, though, because the medical field is always evolving. There's always a new machine or maybe a medication that's new, or you get these chronically ill patients who know how to deal with their own chronic issues so well. And I like to try and learn from them so that way I can learn tips or tricks to maybe pass it on to a different patient that might be struggling with the same thing.
Mm. So, as an educator, as a lifelong learner, you are just experiencing so much while teaching other people very rapidly, especially in the trauma wing that you're in. You have to do it all very quickly. Do you
Yes.
feel that there are mental health supports in the medical space for the nurses, enough for the patients that you're working with?
I like to say that I'm lucky enough to have a facility that does care about their staff's mental health. One of our benefits at my specific hospital is you get like free therapy sessions, 12 per year, so once a month. But I do also think that mental supports in the medical field lag. Um, Nurses, we are known to like be physically abused. We get called different names all the time. We're sexually harassed at times. So that can kind of play into deterioration of your mental health. And so I definitely think that there's a lag when it comes to people wanting to protect nurses and protect their mental health. We have to be able to take care of the people that take care of us when we're sick. And we also need to be able to take care of our patients' mental health because there are so many times I see patients be called, quote, crazy because they have certain diagnoses, but crazy is not a diagnosis. It's chemical imbalances in people's brains, or they're just going through the worst day of their lives. When they come to me, they are so sick that they need to be watched 24/7, every single hour around the clock, because I work in an ICU. But some people don't understand it, and they think that sometimes these people are acting out because of these diagnoses, when in all actuality, they're stressed, which is a trigger for a lot of mental health issues. They might not be getting their home medications because providers often forget to order them. Unless there's a contraindication, we should be continuing these medicines in hospital. And just they're not getting enough sleep. Delirium in the hospital is a big driving factor for unsafe like practices, especially in our mental health patients.
Off of the top of your mind right now, what are some obvious things that you believe could be some supports that should be implemented for your safety, your mental health that you feel are not being utilized or thought about for the nurses and the patients?
I definitely think sometimes management allows for certain types of abuse to happen. We have at my hospital what we call PSAPs, which is essentially a description of behavioral or physical issues that this patient has caused to staff. And we keep allowing them to come. Obviously, if they're on death's bed, they are always welcome at a hospital. But once they exhibit these behaviors, I don't think that they should be allowed at specific hospitals unless it's a life threatening emergency, simply because they just kind of keep allowing this cycle of abuse to happen to staff. And it definitely gets frustrating because there's often this word, if you write an incident report about a patient hitting you, management will ask, well, what could you have done better?
Mm.
Well, I did everything I could. I did my de escalation techniques. My hospital does this thing called CPI training. So that way, if they do try to hit us, we're blocking them We're not hitting them back. We're blocking them. And then we're leaving the situation that's making us unsafe. I definitely think that should be implemented in every single hospital worldwide, not just nationwide, worldwide. But we also have to make these alert and oriented patients who are abusive to staff understand that there are consequences to these actions. And I also encourage all nurses and all medical staff that if you are hit by an alert and oriented patient, file the charges. It is a felony to abuse healthcare workers while they're on the clock. And I think a lot of people are afraid of the repercussions of filing that charge, but you need to feel safe in your work environment.
Do you think filing the charge will just make management more accountable?
I think so, to a certain extent. I think that because we have management that's worked at the bedside, those are your nurse managers. But you also have management that's never worked a single day at bedside, and they're kind of dictating these policies and procedures with other assistance from people who have worked bedside. But I don't think they quite understand the extent that we go through because they haven't been in our shoes.
Where we share stories in the chair.
Look, it's my commercial. We will be right back.
It's more than just a bad hair day. It's a journey. Finding the right hairstyle isn't easy, nor is finding the right stylist or the right products. Looking in every corner of the web gets messy, overwhelming, and exhausting. All the ads, the articles, the products, the videos, it shouldn't be this hard, but it is. And now, it isn't. The Chair. A black and brown centered platform where you can design hair boards, connect to hairstylists, and share hair care tips for a new joyful path on your hair journey. Avoid the clutter, save yourself hours, months, and even years of research and poor trial and error. Everything you need and only what you need is in one place. Hair boards made by people like you, for you. Find the right products, the right people, the right answers for you, stress-free. Join the Chair community and make every day a great hair day. When you share your pain, you allow others to help you. And when you share your success, you help others get theirs. Lean on the Chair. We got you. No stress, no strife. In the chair, the chair, the chair. All right.
In your bio, you express that you have been diagnosed with a mental health disorder. Do you feel that there are stigmas around how you navigate society, the fact that you've chosen to work in the medical field in high stress environments? Do you feel that there are stigmas around your bipolar diagnosis?
I do think there are stigmas. I think that many people don't quite understand the grasp of it. It's not just a disorder where you're happy one day, sad the next, and then you're happy and then you're sad. Everyone gets happy and sad, but bipolar is a lot more than that. So I have bipolar 2, which is my lows are really, really low. And I don't get super high mania. I get what we call hypomania, which still impacts my day-to-day life at times. I do have a great psychiatric team that helps me manage my symptoms, make sure I'm being as healthy as I possibly can, and just help me work through a lot of the traumas I've been through in my life. But when you come to work, I've always heard nurses call people, especially the bipolar patients, crazy. We're not crazy. There is a chemical imbalance in our brain that is causing this. And I do think that having the bipolar makes me relate to my patients more. simply because I like to take the time out of my day to listen to my patients. What's going on? How can I help? And I've also been able to educate some of their family members saying, hey, your family member has bipolar. They're on an antidepressant, but they're not on anything else. Maybe you should talk to your psychiatric team to get you on something else. So that way they're not going into mania themselves and just hurting themselves. And I also think it just makes me an all around better communicator with my other patients who might be struggling with mental health issues. So, as much as people want to shame others for being bipolar, I'm not ashamed of my diagnosis at all.
In high school, I had a best friend who had bipolar disorder. We were 16. So the way we talk about mental health was very different. At that time, she definitely described the lows as very low and her highs as very high. But the one thing that she was so clear about was having her medication regimented and also being able to express her feelings. And as a 16-year-old being exposed to that so early with another teen who had to take care of her diagnosis by herself, who had to be on top of her medication by herself, I feel that I became just more aware of understanding that there are more pieces to someone's story. I feel that for me, mental health isn't very black and white as you described it. And so I'm wondering, how would you say that people should begin to approach having conversations about mental health when they're learning someone is struggling and they have an inkling that it could be something that has to do with a chemical imbalance, but they are unsure?
I think when you think a friend might be going through something, I like to leave all my questions open ended. It's kind of what we learned in nursing school. So I kind of followed that into my day to day life. I always like to reach out to my friends. Are you okay? I'm here if you want to talk, if I ever feel something's wrong. If they don't want to talk, they don't want to talk. I'm not going to push them. In the medical field and when you're at work, it's kind of like a different ball game because you have to be assisting them in managing their medications. You're the one administering it. You have to make sure the provider orders that medication. But I also think that just listening to the patients, hey, I don't like this. Can we try this instead? Sure, let me go ask the doctor. Because at the end of the day, like they know their brain better than I would know their brain. And every single aspect of healthcare, mental health included, is individualized. And it's just kind of important to be there to listen to them. And while I understand that, sometimes we don't have the time to sit in a patient's room for an hour and just talk and talk and talk, we have to be able to know where we can find the resources for this patient, where they can be able to express what's going on in their brain or how we can get them to continue their regimen in the hospital, especially if we don't stop certain medications and they're not formulated in the hospital. And just keeping an open mind, because there's a lot of times when you, as someone that struggles with mental health, like myself included, I get ashamed of my diagnosis sometimes. If I act a certain way, I feel ashamed. So if I find that my space is safe enough for me to open up with my concerns and my feelings, it makes me feel so much better. And so I try to leave that with my patients and my friends. Like, I'm a safe space for you to open up to, whether you open up to me all the way, just a part of the way. If you don't want to open up to me, but you want to leave the door open a crack, anything goes, because you are the director of your own care.
Oh, and if you're interested to learn more about my experiences as a Black woman and educator in Guangzhou, China, I wrote my first ebook titled Nowhere and Everywhere, Captured Emotions of a Beautifully Broken Love Story. It is on lulu.com. Take a read and see some beautiful photography of mine. Enjoy the rest of the show. When it came to your personal diagnosis and you now having a great psychiatry team, how did you begin to put the pieces together? I feel that a lot of people I'm talking to who are on their mental health journey feel like it starts with maybe just a therapist, and it starts with maybe changing their diet. It starts with maybe I should slow down on my drinking, or I should stop smoking because I always feel this way when I do this. It feels like a game of chess when it comes to figuring out how to support themselves, or finding the right people to support them, or not getting the wrong diagnosis because they talked to the wrong person.
Right. It's very complex to get a diagnosis, especially for certain ones, because providers want to stay away from them. I, from an early age, was diagnosed with depression and anxiety. The oldest paperwork I can find tracing that diagnosis was back to when I was only 3 years old. So that's a pretty long time. As I grew up, I had to do court mandated therapy because of my parents' divorce and how bad it got. And so for a while, I was put in with these therapists, and I had one that I loved so much, but she ended up retiring by the time I was 7. And so I went through many, many years of not finding a therapist that was right for me. And then when I was 18, I was having some suicidal ideations. So I checked myself into the hospital. I was put into a psychiatric facility for about a week, and they only gave me an SSRI to leave. They didn't know I had bipolar at the time. They just said I had a mood disorder. So I was taking an antidepressant on bipolar without anything to kind of bring me down. So then I would get my really high highs would be so bad. And I'm like, this isn't right. And it took me a while to find not only a therapist that could help me navigate through my issues in a comfortable manner and allow me to be myself within our sessions, but it also took me a while to find a psychiatrist that would listen to me and that just wouldn't throw me on every single med in the book. Or if I complained about like a symptom that was really bothering me or a side effect, they wouldn't just brush it off and be like, let's wait another month. Let's wait another month. So for those who are starting their mental health journey, if you don't feel comfortable opening up with your psychiatrist or your therapist, get a new one. This is you talking about your deepest traumas or very, very sensitive topics that sometimes you're not proud of. It could be something you did and you're not proud of it. So you need to be able to feel comfortable to share those moments in order to fully and truly get the help that you need.
Thank you for sharing. I'm so angry right now. I feel like there are so many systems that are not like, we fail kids. We fail them when they are coming to these systems and these supports that are supposed to be there for them. How many iterations do we need to get to what you really need? Like, I know there's trial and error. I know people need to figure out their balance in terms of how much is too much or how little is too little. But if you aren't talking, if people don't feel comfortable to talk about what it is that's wrong, what it is that has happened to you, to make sure that people sending you in the right directions, the medical professionals, the social workers, the therapists, the court mandated reports are written in a way that is helpful to get you to those exact resources. It's like we fail our kids so often.
I agree.
Well, thank you, Arielle, so much for sitting in the chair and sharing your stories. I truly, truly appreciate it.
Thank you for having me.
Welcome to the chair, where Miss Dream always has a story.
Thank you for listening to an episode of The Chair. I'm going to share with you a dream of mine. I would love to be on Sesame Street. Sesame Street held my hand through childhood, In my dream, I would be in my big afro or rainbow braids sitting on the stoop sharing hair stories. I would like your help, please, by doing all the things like leave a review, share it with someone who would benefit from hearing this episode. And if you know someone who knows someone who knows someone at Sesame Street, share your favorite episode with them and I'll make you some of my famous chocolatey hot chocolate. I hope you have a beautiful day, or if you are like me, still up in the middle of the night, I hope you take a deep breath and rest. Love you. Talk to you later.
Hello. Please leave a message after the tone.
Dream, hello. I just wanted to tell you you're wonderful. I just got through going through your podcast. Love you, love you, love you, love you. Keep it up. Maybe I need to send it to Oprah and Tyler Perry. Love you, baby. You are great.
Where we share stories in the chicken.